Good day, dear friends. Glad to welcome you on the channel Doctor Savkina. Today, we will talk with you about omeprazole, better known to many of you under the trade name AMEZ. About 3.5 years ago, it received the Product of the Year award as one of the most popular mass market products. Is it safe? What side effects does it cause and how to avoid them? Recently, a middle-aged man came to me complaining about pronounced weakness in his legs, which made it difficult for him to move. At night, he had to walk around the rooms for a long time due to feelings of numbness, burning, and tingling in his legs. From his medical history, it was revealed that for nearly 2 decades he had been constantly drinking diclofenac day in and day out. And from the excess which this drug caused, he intermittently, constantly took omeprazole. Regrettably, the prolonged and constant intake of omeprazole in this situation led to the development of polyneuropathy. In other words, damage to the peripheral nerves. Normally, the stomach environment is acidic. Hydrochloric acid is primarily responsible for antibacterial protection. If you constantly reduce the acidity of gastric juice over many years by using omeprazole, the absorption processes of vitamins and vital microelements are undoubtedly disrupted. And first and foremost, calcium, magnesium, and iron, as well as intrinsic factor of Castle. Its main functions are to transport vitamin B12 and facilitate its absorption in the small intestine. Constant long-term use of omeprazole leads to a deficiency of vitamin B12 and the development of severe anemia, also known as pernicious. In addition, a deficiency of vitamin B12 contributes to the development of polyneuropathy. Referring to the instructions for taking omeprazole, we clarify that this drug relieves heartburn, is used in the treatment of gastric and duodenal ulcer disease, gastroesophageal reflux disease, in other words, the reverse throw of the stomach contents into the esophagus, and also to eliminate Helicobacter pylori as part of complex therapy. In addition, it is prescribed to reduce aggressive effects during long-term use of non-steroidal anti-inflammatory drugs. As a rule, omeprazole is taken in the morning 30 minutes before breakfast, washed down with half a glass of water. The recommended dose is 20 milligrams per day. The maximum course of treatment without a doctor's consultation usually takes about 2 weeks. The key word of this sentence is maximum. I emphasize this for your attention. Omeprazole, of course, is a very valuable and good drug that has prevented the development of peptic ulcer defects in many patients. By reducing the production of hydrochloric acid, this drug contributes to the rapid healing of the gastric mucosa. To this day, there are a large number of analogues of omeprazole. These are lansoprazole, pantoprazole, the most well-known under the trade name Nalpaza, rabeprazole, Pariet, as well as esomeprazole, Nexium. All of them, like omeprazole, contribute to the reduction of magnesium in the body, as well as potassium and calcium associated with it, which in some cases leads to the development of arrhythmia, up to epilepsy. Some patients on long-term omeprazole experience headaches, dizziness, and drowsiness. From the side of the gastrointestinal tract, there may be stomach pain, discomfort, nausea, in some cases liver damage, skin rash, and bone fragility up to the development of pathological fractures. And first and foremost, fractures of the neck, thigh. And of course, polyneuropathy, which I told you about at the beginning of this video. To avoid such side effects, you cannot take omeprazole uncontrollably for long courses without a break. And if it comes to side effects, you can take Panangin to replenish the lack of potassium and magnesium. Also, do not forget about taking calcium-containing preparations, for example, calcium D3. In addition, it is necessary to replenish the deficiency of vitamin B12. How to do this? I suggest you watch this video. Stay healthy, dear friends, and until new meetings,